Bilirakis, 5 minutes for
Thank you,
questions,
Mr.
please.
Chairman. I appreciate it very much. I thank the panel for their testimony as well. Mr. Holtz-Eakin, I understand you run your CBO and you currently run a think tank.
That's correct.
Your organization recently did a review on the various replacement plans that conservatives have introduced. There's the Better Way by House Republican Conference, the Patient Care Act, the Improving Health and Healthcare Act, Empowering Patients First Act, the American Healthcare Reform Act, the 2017 Project, and the world's greatest healthcare plan. When people say Republicans don't have a plan, that's simply not true. There are many plans and competing ideas. However, it would be fair that there are certain common areas that are in most of these plans. Can you talk about the ACA provisions that, in your expert opinion, would most likely be kept?
Yes, I mean, one of the reasons we
elaborate,
wrote the paper is that there's an enormous amount of overlap, and so it seems to me to be sensible to expect those to be present in any replacement plan. So all of them allow children to stay in the parents' policy until 26, as in current law. All prevent discrimination against those with pre-existing conditions and guarantee the issuance of an insurance policy. All of them ban caps on annual or lifetime out-of-pockets for individuals. And then they all have subsidies for individuals, typically age-based, so that the elderly, the older and more likely to be expensive patients get some help. All of them have some sort of risk pool for those who can't be managed in the normal pool, and all have some sort of approach to the continuous coverage idea, where the differences, quite frankly, are in how do you handle the gaps. Handling the gaps, I want to echo what was said, is a really important issue. All of them have some provision to cap the exposure that an individual would face if somehow they did develop a coverage gap for reasons outside their control. So there's all these common elements in these replace plans.
Very good, thank you. Mr. Weisky, when the ACA was passed, there were several promises made about it. The American people were promised they would bend and cost curve through increased competition in the health insurance market. In Florida today, 73% of the counties have only one health insurer, and average premiums increased by 19% last year. I fear that what it will look like in 2018. You mentioned that in Wisconsin you have an active insurance market pre-ACA.
Yeah.
And then how was the health market before ACA and now with the SCA? Can you discuss that?
Yeah, I think we still have a highly competitive market, so we're fortunate. We still have a lot of choice in our market, but it's evaporating slowly but surely. And we've seen carriers consistently move their market around, move their coverage areas around. So there's a lot of instability. They've changed their networks. They've changed their networks around in order to deal with affordability and competition and issues. And the net result for a consumer is consumers don't have as many choices as they had before the ACA. They have fewer choices in coverage.
Thank you. Mr. Holtz-Eakin, again, just in case members of the minority might not be familiar with our Better Way agenda, can you please detail that the Center for Health and Economy Analysis finds the plan broadly, what it accomplishes, again, the impact on premiums, would they increase or decrease? What about provider access? Would there be an impact on the federal budget? Can you go ahead and discuss that?
The Center for Health and Economy, of which I'm a board member, did an analysis of the Better Way plan. I won't remember all the numbers right, but broadly speaking, the insurance market deregulation lowers premiums something in the vicinity of 15% or so. Lower premiums improve private coverage in that plan and expand coverage. As a result of both the lower premiums and the subsidy structure, there's less stress on taxpayers and there's budget savings in the Better Way plan. Underneath the plans, it's important to identify what kind of networks and provider access are available, and access is improved. And there's an index of medical productivity, something you think about in terms of an index for bending the cost curve, and there's improved medical productivity in the plan.
Thank you very much. I yield back, Mr. Chairman. Appreciate it.